Hi everyone. Today I just start a lecture on medicine. In medicine, today I will talk about the hepatology part. In hepatology, I will talk about complete detail in the jaundice, what's the pathophysiology of jaundice, and what's the signs of chronic liver disease. So that my lecture will be divided into 5 to 6 videos because that will not cover in one video. So so today my main focus will be on jaundice. So actually what is jaundice? Today I will talk about this. So actually jaundice, definition of jaundice is that when there is a yellow coloration of the mucous membrane of skin or sclera of eye due to increased bilirubin level in the body fluids like plasma level in the plasma that is more than 2.5 mg per deciliter. So actually this is a major definition when in the blood bilirubin become increased, either indirect or direct or unconjugated or conjugated bilirubin when increase more than 2.5 mg per dl, and with clinical signs like yellowish of sclera, skin color change with so when more than 2.5 mg with clinical signs, that shows us that that patient have jaundice. So this is the major definition of jaundice. The clinical features with lab values both link each other and they give us a clue about the jaundice. So according to the classification, we classify jaundice into three subtypes. Like then there is a pre-hepatic jaundice, then there is a hepatic jaundice, then there is a post-hepatic jaundice. So in my that lecture I will talk in a detailed way what's the pathophysiology of pre-hepatic jaundice and what's the pathophysiology of hepatic jaundice and then post-hepatic jaundice. So first of all, before starting the jaundice, first of all I would like to talk about the basic physiology, that how the bilirubin metabolism is formed. Actually see in that picture, first of all there is a RBC breakdown occur. When the RBC breakdown, we know that RBC is composed of hemoglobin. So heme is the part which contain iron and globin is the part which is a like alpha chain and beta chain. So alpha and beta chain composed of globin. Globin is what? Protein. So heme, so RBC is made up of hemoglobin. So when RBC break down after completing his life cycle like 120 days, so they break down into heme and globin. Then heme is split into what? In the bilirubin and iron. So that iron stored again into the liver, in bone where iron needed. So iron is not a waste, it's a play important role for making RBC, and so iron is again restored in the liver as well as in the bone. And this bilirubin unconjugated, that will be excreted, that will be conjugated. So bilirubin unconjugated will take by the liver cell like hepatocyte, and they make the unconjugated bilirubin into conjugation. So that point arrow point, enzyme work which conjugate the unconjugated bilirubin. That enzyme we call what? Glucuronide transferase enzyme. So in the pre-hepatic jaundice, that there is a cause. I will talk about that what's the significance of this enzyme, that not mentioned in that picture, but enzyme is working in that place. So enzyme doing what? They conjugate that unconjugated bilirubin. So that bilirubin come from where? From the heme part. Which heme part? In the porphyrin ring, because because whole RBC is made up of hemoglobin. So heme breakdown, they convert into iron. Iron is restored in the liver and in the bone, and then the waste bilirubin. There is a multiple process, biliverdin, then biliverdin oxygenase enzyme. So I will not go into detail, just I will talk about the briefly that how the bilirubin become conjugated. So after conjugation, then they stored in the gallbladder. Then after that they secrete in the duodenum. In the duodenum, then again 90 to 95% of bile reabsorbed at the terminal ileum, and 5 to 10% excretion in stool. Okay, so in my next video I will talk about